care providers in England are calling on the government to make plans to allow people to visit relatives in care homes. Visits were banned over 12 weeks ago as care homes across the UK closed their doors to try to protect their residents and staff. The Care Quality Commission, which also suspended routine visits, has found a 66% increase in reports from staff who have raised concerns. That happened in the 3 months to May. Now, in the past 24 hours, in hospitals, care homes and in the community throughout the UK, 184 people with COVID-19 are reported to have died, and that brings the total number of those who died with coronavirus in the UK to 42,153. Our correspondent Alex Forsyth has more details.
Do you know, it's 12 weeks since I've seen you. It's a long time, isn't it?
A long time.
Finally face to face. For the first time in 3 months, Jenny got to see her 98-year-old mum Millie in person.
She's very, very frail. You never know from one day to the next whether you're going to see her again. So it's been lovely to see her, really, really lovely.
This care home in Oxfordshire has started allowing some relatives to visit their loved ones. Outside only, at a safe distance, with plenty of sanitation. But it's been a welcome start.
We've obviously had to keep things very safe and we've abided by all the regulations, but we just thought it was really important that we did something to bridge that gap.
But not all care homes are allowing visits like this yet. Some simply don't have the facilities or space. Some want more guidance from the government. Kathy's had barely any contact with her mum Mavis for months. At 90, with dementia, phone and video chat is hard, and her family is worried.
Her dementia will worsen. There's absolutely no doubt about it. She's still part of our family, so we want to see that person again before she deteriorates to the point that we can't do that.
As lockdown gradually eases around the country, many in the care sector say they must have an exit plan too.
I understand the government is actively looking at this issue and the guidance will be updated fairly soon. It is complex and care providers are the first to say safety must be paramount. But they say the risk of the virus must be balanced with the risk that continued lockdown poses to general health.
We're calling on the government to provide that crucial support that's needed for care providers on how they can safely allow crucial visits for the many older people whose physical and mental health is seriously at risk.
Since the lockdown, there's been an increase in care workers reporting concerns to the watchdog, among them fears about PPE and infection control, another sign of the strain this pandemic's placed on staff, as well as residents and their relatives. For some now, visits are helping. Back in Oxfordshire, a lifeline for Claire and her mum Kathy.
It's been really hard. You just want to give her a hug, a big hug. It's reassuring to know that she's still happy.
But this is only happening in a few homes. Many want more government advice. Ministers say they know it's been difficult for families and want to lift restrictions as soon as it's safe.
Will it ever end?
For many, that can't come soon enough. Alex Forsyth, BBC News.
More than 1,500 senior doctors have called on the Prime Minister to prioritise the opening of schools in England, or in their words, risk scarring the life chances of a generation of young people. The paediatricians have signed a letter asking for authorities in England and Northern Ireland to follow Wales and Scotland by laying out more detailed plans for getting children back to the classroom. Now, our health editor, Huw is with me, and this is quite a letter, isn't it?
Yes, Hugh, it's significant because these are paediatricians. They're responsible for the physical and mental health of children, and they're saying the latter is much more important here rather than worries about contracting the virus. They're saying that school is about much more than learning. It's a vital contact point with public health services like mental health support for children. So they're urging the government at Westminster to get on with producing a detailed plan for getting schools back in England, and they say the devolved administrations should work on recovery plans as well. Now, Oliver Dowden, the Culture Secretary, said at the Downing Street briefing, yes, it was vitally important to get children back to school, but parents had to be reassured it was safe. Nicola Sturgeon, Scotland's First Minister, has said it's possible there could be near normality for Scotland's schools when they go back in August, depending on the situation with the virus. Now, of course, getting children back and easing lockdown restrictions does depend partly on a testing and tracing plan. And the government at Westminster had to admit today that a smartphone app, which had been billed as a centrepiece to be rolled out in May, wasn't likely now to appear till the winter because things weren't quite right with it, so it wasn't a priority right now.
Many thanks again. Huw, our health editor there.